This is Coach PDHPE with another Core 1 video. You can find others at coachpdhpe.com. We're up to key idea 2 of Core 1. What are the priority issues for improving Australia's health? We're up to the dot point, groups experiencing health inequities, and this video is focusing on the inequities experienced by Aboriginal and Torres Strait Islander people. The student learn to side of the syllabus requires you to have an understanding of 3 questions. I've rewritten them this way just to make them slightly easier to understand. They are: what are the inequities that ATSI people suffer? How do the determinants contribute towards the inequities? And finally, what role should individuals, communities and governments have in overcoming the inequities? The first dash point is: what is the nature and extent of the health inequities for ATSI people? The Fred Hollows CEO recently said, "There is no excuses for Australia to be the only developed country in the world where Indigenous men in some areas have a life expectancy of just 46 years of age, where babies are dying at a rate 3 times higher than babies born to non-Indigenous parents." I think in any response to this type of question, your writing should echo those of this quote, because the health inequities experienced by ATSI people are simply unacceptable and a blight on the country of Australia. So let's have a closer look at some of these statistics. For life expectancy, an Indigenous male has a life expectancy of 11.5 years less than non-Indigenous male, while for the females it's 10 years less than the rest of the population. For infant mortality, the rates are also not great. The infant mortality rate for Indigenous people is 8 deaths per 1,000 people, while for non-Indigenous people it's 8 deaths per 1,000. That's infant mortality rate of twice the rate compared to the rest of the population. While for cardiovascular disease, Indigenous people are 1.3 times more likely to suffer cardiovascular disease, and for diabetes the figure is even worse. They are 7 times more likely to suffer diabetes than the rest of the population. Indigenous children also have poorer eye health and hearing problems than the rest of the population. This makes it really difficult for Indigenous children to attain good education results, which we'll learn later on has a significant impact on health outcomes. So the second dash point: what causes these inequities? They are what is known as the determinants of health, which are the socio-cultural, environmental and socio-economic determinants. This quote sums up all of those 3 determinants. More than 200 years of dispossession, racism and discrimination have left Indigenous Australians with some of the lowest levels of education, highest levels of unemployment and the poorest health and most appalling housing conditions. So the first of these determinants is the socio-cultural determinant. Mainstream health services often lack the cultural sensitivity and remain unwelcoming places for many Indigenous people. While the Indigenous health workforce remains too low when compared to the number of Aboriginal and Torres Strait Islander people that make up the Australian population. It has been proven that successful Indigenous health programs have been those that have recognised and addressed these factors. Those factors are that to make health facilities more welcoming place for Indigenous people, and also to get more healthcare of Indigenous descent working there. Also, ATSI people are far more likely to have behavioural risk factors such as binge drinking. Socioeconomic determinants. Socioeconomic disadvantaged people often cannot afford to make healthy lifestyle choices due to as simply as buying fruit and vegetables, which particularly in remote areas are very expensive. More ATSI young people drop out of school before Year 10 and fail to complete Year 12 than non-Indigenous Australians. High levels of education have been associated with healthier lifestyle choices and improved health literacy. The capacity to access goods and services required for a healthy lifestyle, including adequate nutritious food, housing, transport and health, is largely dependent on income. Finally, environmental determinants. Over 20% of ATSI people live in remote and rural areas, therefore reducing their access to many health services. Water supply in remote communities is often simply not adequate. Lack of adequate infrastructure in remote areas such as transport is just not good enough, and poor communication. They don't really have great access to telephones and internet in rural remote areas. Finally, the third dash point. What is the role of individuals, communities and governments? The first dash point looked at how big the problem is, the second dash point looked at some of the reasons behind it, and finally, what can be done about the problem. Firstly, the role of individuals. Education is the biggest factor in an individual's ability to have control over their health choices. Better educated people have lower morbidity rates for some of the most common illnesses, including cardiovascular disease and cancer. Greater resources associated with higher levels of education and a learned appreciation for the importance of good health is one of the results of individuals having better control over their education. There has been a recent focus on educating women and mothers in the Aboriginal communities, as they are seen as being the decision makers within the family and on health decisions within the family. Finally, the role of communities. Aboriginal health services work in partnership with the local communities to improve healthcare. They are often specific health services aimed directly at ATSI people. These services are usually controlled and operated by the Indigenous community, e.g., providing transport to make medical appointments. Leaders of ATSI community need to have a strong voice in informing government of the needs and challenges they face in relation to health. Often non-Indigenous people are out of touch with the methods that will work best. The last one, the role of government. Programs such as ABStudy helps with the cost for ATSI Australians who are studying or undertaking an apprenticeship to improve their education levels. The recent Close the Gap campaign is a government initiative to close the gap in both health and educational outcomes by providing additional funding. And finally, the role of government is to have an improved relationship with the ATSI leaders using an intersectoral collaboration approach. Conclusion, it's a complex issue as to the reasons why there are inequities. It's probably a more complex of how to address the inequities. Improvements in infant mortality and life expectancy have been occurring in recent years, but there is still a long way to go. You can find other videos at coachpdhpe.com or follow on Twitter at coachpdhpe.com.